Hello, everyone. A very good morning, everybody. I'm Priyanjali from Prostate Wellbeing Team. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic: benign prostatic hyperplasia, also known as BPH. Benign prostatic hyperplasia is a non cancerous enlargement of the prostate, usually begin in the 50s in men, and which in many men cause obstruction to urine flow. Many men have to get up and go to the toilet at night. It is the most troublesome aspect of this condition, as it makes them tired during the day. Having to urinate frequently during the day, sometimes with a sense of urgency, can be tiring for patients and can make traveling or attending events such as theater or cinema rather difficult. A doctor, such as urologist, can treat this condition and help the patient to get relief. To throw more light on the subject and guide us on what's right for diagnosis and treatment of BPH, today we have with us renowned urologist Dr. Neel Patel, MBBS, MS, MCH Urology, DNB Urology. He has a rich experience and hands on expertise in stone management as well as in treating urological problems. He is currently practicing at Love Care Urology Centre, Surat. Dr. Neel Patel has rich experience in the field of urology and carries out the diagnosis and treatments with utmost precision and efficiency, ensuring that the patient health is in safe hands. Over to you, sir. A very good morning, first of all, and welcome to today's platform. Doctor, first question for you would be, what is BPH?
Good morning. Thank you for the kind introduction. BPH is known as a benign prostatic hyperplasia, as you mentioned. So, prostate is a gland that is present in every male. Okay, it's present right from the male is a child, like it's present right from the male child's birth. But however, it starts to enlarge after the age of 50 years. So when it enlarges, it compresses the urinary tube that is commonly called as urethra, and this prostate gland is situated just below the base of the bladder. So when it enlarges and it compresses the urinary tube, and it creates a obstruction in the flow of the urine. So the most common symptom that a patient of BPH present with is increased urinary frequency, and that is particularly at night time. That in a medical term is commonly called as nocturia. Another most common symptom is a weak urinary stream as well as straining during urination. So this kind of problems create lifestyle discomfort. So some old age male who are having such problems, they avoid traveling or going out or going to cinema, and that creates psychological impact, and that also affects their sexual life as well as social well-being.
Right. Well, very true, doctor. We can totally agree with all the points that you are mentioning today. Doctor, the major question arises is, what are the causes of BPH?
So the most common cause is the old age, right? After 50 years of age, prostate eventually starts to enlarge. It's like old age phenomena, like graying of hair, you develop cataract. Same is the thing that in old age you start to have an enlargement of prostate. So at around 50 years of age, approximately 50% of patients have this benign prostatic hyperplasia. At around 80 years of age, as the age advances, the probability of developing BPH is around 80%. But now, not all patients who are having BPH have prostate their symptoms, right? So we treat only those patients who have developed the symptoms of BPH.
Right. Doctor, as you mentioned, old age can be a reason for this. I mean, old age is the major reason for this. So, doctor, please tell us, is it always compulsory that mostly people, as we see that people suffer during the old age, so how can we not have it, or how can people avoid from having it, or is it like anyhow going to happen?
So certain measures that we can follow are called as lifestyle modification. Like in
Right.
those patients who are of old age, they should avoid fatty food. Okay, they should avoid alcohol consumption, diuretics. They should avoid caffeinated beverages. Aggravates the symptoms of BPH. And pelvic floor exercises, they are helpful. So if they follow this kind of modification, lifestyle modifications, then there are probability that the symptoms of BPH can be delayed.
Right. Doctor, as we know that lifestyle changes can be responsible for most of the diseases. It can be also the cure for most of the diseases. And as you mentioned, that few small changes in life can make a bigger change. And so, how does a person initially knows that he is having BPH? What can be the initial symptoms for it?
So the most common symptom is increased urinary frequency. So the normal daytime frequency is around normal male, healthy male goes to urination every 2 to 3 hours. So if your urinary frequency is like you have to go to urine every 1 hourly, or it is less than 1 hour, like in 30 minutes, 40 minutes, you have to go for urination, then it is a common symptom of BPH. Another common symptom is a nocturia. So once you go to bed, so the normal person do not wake up in the night to go for the urination. So if a person has to wake up more than 2 times at the night after going to the bed to pass urine, then it is called as nocturia, and that is also a common symptom of BPH. Another symptom is some patients may notice that there is a weak stream of the urine. The urine flow that was previously is not present now. So that is also a major symptom of BPH.
Right. Doctor, as now that we know the symptoms for BPH, please tell us if a patient is conscious in the initial days. Like we know that for any sort of diseases, when we prolong the days, it happens to increase day by day. So does is the same case for BPH as well? Or if we get to correct ourselves in the initial days, or if we can identify the disease in the initial days, is there a probability of having a cure a little sooner?
So there is tendency of the prostate gland to enlarge with the time. So, but it enlarges slowly. It doesn't enlarge in few days. So there is a gradual enlargement in the gland of the size. And as it enlarges, it's going to compress the urethra, and patients will have more symptoms of BPH. So if such patients are having those kind of symptoms, I advise them to visit their urologist, okay, to get that checkup done if it's a BPH, or sometimes it can be a cancer also. So better to get a urology consultation done. Your urologist will advise you to follow certain lifestyle modifications. Okay, as the first line of management. If there is no improvement with the lifestyle modification, then your urologist might prescribe you some drugs also. So in that way, the symptoms of BPH can be cured.
Right. Doctor, speaking about treatment, now let's talk about the treatments available for BPH. What can be the treatments available?
So, if you go to your urologist with this kind of symptoms, right, your urologist will first assess what kind of symptoms you are having. They will, there is a specialized score, IPPS score. So, in that, we assess the severity of the disease. It's a mild severity, moderate, or it's a very severe disease that we can assess with the symptom scoring. The next line is digital rectal examination, where a urologist will do a rectal examination by his finger to see the consistency of the gland, as well as the size of the gland can be assessed. It can give a rough estimate about the presence of benign prostatic hyperplasia, that is a benign disease, or the presence of cancer in the prostate. The next line of test that doctor can order is a urine test. That will be that urine test is done to see for the presence of any infection in the urine, presence of blood cells in the urine, or there can be the presence of diabetes or any kind of protein that is lost in the urine that can be assessed via doing the urine test. Another test your doctor advise is a PSA, that is a prostate specific antigen test. That is a screening test to see whether the person having a benign disease or he's having the cancer. So normal range of PSA is around 4. So if PSA rises above the 4 nanogram per milliliter, then there are high probability that patient can have a cancer in the prostate gland. Another test your doctor will advise is a uroflowmetry. That is that we in a layman term, it is a flow of the urine that can be tested. So whether the flow is normal, it is obstructed, that can be assessed by the uroflowmetry test. It's a simple test that is available at your urologist clinic, where you have to hold urine and pass urine in the specialized instrument. So that instrument, with the flow of the urine, calibrates the flow and gives a recording of the person's urinary flow. Another test your doctor can order is a urine USG, that is ultrasonography of the kidney, ureter, and bladder region. So with that, we can see the prostate size, what is the status of the kidney, how much urine can person hold, and what is the amount of urine that is left after the person has voided. So all this kind of test and physical examination can help doctor to manage the disease properly.
Right. Doctor, speaking about again going back to the same point, BPH, we know that we waking up, late in the night for regular urinating is a very common symptom. Tell us, doctor, if it is painful as well. Is it painful anyhow?
So generally, BPH is not painful. It's only painful when a patient develops infection. So the cause of infection is a stored increased post-void residual. So if there is a obstruction in the flow of the urine and some amount of urine gets left in the bladder after the person has voided, then that stored urine gets infected and it causes the burning sensation as well as pain in the lower abdominal region. Also, there can be prostatitis, like infection in the prostate, that can lead to lower abdominal pain, perineal discomfort, as well as pain after urination or pain during urination.
Well, the entire thing sounds very scary. Doctor, well, speaking about infection, we know that urine infection takes a lot of time to eliminate from our body. So, if it is not treated at the perfect time or the right time, what can be the worst case scenario?
So there are signs and symptoms of infection like increased urinary frequency. Patient can have burning sensation. If infection is severe, then patient can develop high grade fever. Also, there is a loss of appetite. You don't feel going out. You feel lot of weakness, body ache. So these sort of symptoms may present if patient is having infection. If infection is of a higher intensity, then it is called as sepsis. Like, so in that case, the all the blood pressure of the patient goes down. He requires a hospital admission. IV fluids, IV antibiotics needs to be administered, and it can also affect the kidney function also. So better, if patients are having any such type of symptoms, they should consult their doctor immediately and not wait for the infection to flare up and show adverse sign or symptoms on your body.
Right, exactly. That's what we always suggest our viewers, or for all the people who are watching us right now. Please get yourself treated as soon as possible in the initial days. Do not prolong it. Do not lengthen the process. Otherwise, it's only you and you who would have to suffer. Doctor, I can see a few questions coming up from our viewers. Aditi Shrivastava asks, "My husband is having this problem. I need to know how BPH can be prevented, and are any ways to lower the risk?"
So, as such, for prevention, there are certain lifestyle modification, as I have advised that BPH is more common in patients who are obese, who are consuming high fatty food, or who are consuming excessive alcohol, or doing smoking or taking excessive caffeinated beverages. So that's all a person can avoid. They should maintain a healthy lifestyle, do regular exercises. Pelvic floor exercises can also delay the occurrence of BPH.
Right. Well, Aditi, I believe you have got your answer. Just a few here and there food changes, maybe just a normal, healthy lifestyle, staying away from the screen and having a quality time in between the greens. I think these are the few things which can definitely put some great effect on your body. Also, the
Absolutely.
food we are eating, with every passing day we can see that the food is changing drastically for all the human. Um, to get fit, we take some over the counter medications maybe. Also fast food has a very very high impact on the lives of human. Doctor, how important is it to have a healthy diet, just usually?
Yeah, it's not only for the prostate but also for the overall health and well-being of the patient. So healthy diet is
Mhm.
very much needed. We are developing the westernized lifestyle. Lot
Right.
of people are eating junk food, so it not only affects your prostate but it also affects the heart, your blood circulation. You get a lot
Exactly.
of cholesterol deposits in the blood vessels, and then there are high chances of developing diabetes as well as myocardial infarction, that is called as heart attack, stroke. All types of ailments increase in the body. Also erectile dysfunction is quite common nowadays in a young
Mhm.
population that was previously
Right.
seen at the age of 50 to 60 years. But because of bad
Mhm.
lifestyle habits and consumption of lot of junk food, we are seeing lot of erectile dysfunction patients in as early as 20 to 30 years of age. So maintaining uh, proper lifestyle by consuming uh, good eating healthy, eating green vegetables, fruits, doing at least half an hour regular exercises, I guess it's enough.
Right.
Taking proper sleep is
uh
also important. Correct.
Exactly, exactly. Doctor, also speaking about sleep, I think until and unless our body gets tired, we are unable to sleep. Usually हमारे साथ भी ऐसा होता है कि रात को बॉडी थक नहीं रहा है तो पूरी रात हम
Correct.
जगे हैं, एंड देन नॉर्मली हम सुबह लेट से उठते हैं, which is
Right.
also another problem, getting up late in the morning. We nowadays people, we don't get to see the sun rays. लोग हैं ऐसे काफी सारे जो दोपहर को, after they get up after 12 in the afternoon, so basically they do not get to see the morning, they do not get the proper sun rays. So somewhere I think this is also affecting. What do you have to say about this, doctor?
Yes, definitely. Early morning sun rays give good is a good source of vitamin D, and we are seeing a lot of patients who are having vitamin D deficiency because they don't go out in the early morning. The main
Right.
reason I feel right nowadays is that they are there's a when they come home, patients are lot of people are addicted to their phone screen. Like they are
Right.
seeing
Right.
watching videos or surfing on the internet till late at night, and because of those rays and the screen time, they are not getting the good quality of sleep. Even if they take proper 7 8 hours of sleep and they wake up in the morning, their body is not very energetic. So what I
Right.
would advise also as a lifestyle recommendation is to avoid screen time at least 2 hours
Mm-hmm.
before going to sleep.
Exactly.
Yeah.
Also, we have a tendency of getting up in the morning, opening our eyes, and search looking for our phone. That's the
Yes.
first thing we see
Yes.
people doing. I think avoid phones before
At least one
sleeping.
hour.
Also, avoid phones after getting up in the morning. These
Yes,
are the two
definitely.
basic. Right. Doctor, will
So
quickly move on to the next question, which comes from
sure.
Akshay. Akshay asks, "Is there anything I can do to manage BPH at home?" Please answer.
So there are certain home remedies that what I advise is a lifestyle modification, but not all patients, all BPH patients can be treated or get cured with only the home remedies or lifestyle modifications. If you are not improving the lifestyle modifications, then there is a need to consult your urologist. So you can be put on certain kind of drugs. These drugs are wonderful. They don't have any side effects. They improve your urine flow. You get proper sleep. Next day you morning you wake up fresh, so your quality and overall your confidence gets improved. So don't
Right.
only
Doctor,
depend on home remedies or lifestyle modification. If it is not improving with these home remedies, then better to consult your urologist.
absolutely, absolutely. Well, we have our experts always around you to help you out in any case situations. May it be just the initial stage, maybe the worst case. We have our experts. So please, please do not use any sort of self medication, visit your nearest expert, and I believe your problem will be resolved within the minimum time. We have the next question coming up from Bhavesh Mittal. Bhavesh asks, what role does mental health play in managing BPH in old age?
So mental health is also a very important aspect of having a good physical health as well as overall prostatic health. For proper mental health, you need to have a, so both mental and physical health are interrelated. If your mental health is healthy, then physical health also improves. If you are physically active, consuming good diet, doing proper exercise, then eventually it will have a good impact on your mental health also. But if a patient is not getting proper sleep, because a person has to wake up 3 to 4 times in the night after going to sleep for urinating, then it can also disturb their sleep as well as mental health. So mental health is a, so prostate also affects the mental health, and mental health is also affecting the prostate problem. So both are very much interrelated.
Right. Doctor, speaking about stress or mental health, I think this can be the reason for many diseases which is occurring. So, what can be the best way of releasing our stress according to you?
So best thing what I would suggest is adequate sleep. You should wake up, better to wake up before the sunrise, get at least 1 hour of exercise done in the morning
Mm-hmm.
if it's preferable. Okay, take proper diet, because consuming junk food, eating late at night, that also affects our physical as well as mental health. So this type of lifestyle modifications are very much needed for having a good mental health also.
Right. Right. Also, I think with time, we are constantly working. People have become so much work addicted or workaholic, as we call it. Um, we are actually working for ourselves, right? We are working for the food, we are working to survive. But ultimately, we are affecting our survival by
Definitely.
not taking care of our health, by not eating the proper food, by not having a proper lifestyle. We are, it's such surreal, it's so ironic that we are doing it for ourselves, but we are also doing the bad things. It's just us who are doing everything. Well, जैसे हम हर चीज कर रहे हैं, वैसे अच्छे काम जैसे हम कर रहे हैं, बुरे काम भी हम ही कर रहे हैं. So it's very ironic how the situation is arising with time. Doctor, also tell us about water. We know that water is the source of life. We see that just because of the work routine, how people are having these days, they tend to, take a very less amount of water. How does that affect our life?
So, normal healthy adult male requires around 2 to 2.5 liter of water on a daily basis. That's roughly equals to around 12 to 14 glasses of water per day. If you are doing heavy workout or there is excessive sweat, or you are working in the hot environment, then your water requirement increase to 500 to 1 liter more. So around 3 to 3.5 liter. Right. So that amount of water is needed to keep our skin, our kidney, our all our entire well-being of the body. Some, because of busy and stressful lifestyle, sometimes people forget to drink water at a regular interval, and that can lead to dehydration. That can affect your kidneys. It can lead to urinary tract infections. We are seeing so many female patients who are working day in and day out, and they are not consuming proper water. As such, women have a more tendency to develop urinary tract infection compared to male patients. So women are
Mhm.
most commonly get affected by the urinary tract infections. But in old age, male also have the as much as higher chances of developing urinary tract infection as much as female. So in old age male also the inadequate water consumption is needed to prevent the occurrence of urinary tract infection.
Well, today we are just talking about basic things, basic lifestyle, basic food habits. Uh, just few basic things if we intake in our life, I think our life will be much more simpler, easier, and stress free. The word stress,
Yes.
which we are stressing on today, we need to stress it out of our life.
So
We
everyone
are
knows, yeah, everyone knows that we have to take proper water, we have to do regular exercises, we
right,
need to take proper
right.
sleep, avoid junk food. These are all simple things. There is nothing new, but it's
Mhm.
the discipline that one person has to follow and adequately manage the proper
Right,
time. That is the most important. Otherwise, life is very easy. Just need to follow certain basics and you have to keep it simple. We are anyway complicating things like we are eating out, working out till late at night, not taking proper sleep. That eventually affects your life and overall physical health. So these are the simple
right,
things, nothing new.
right. Nothing new, doctor. But
Yes.
we tend to miss out on the basic things. Exactly, we are looking at the bigger picture first, but we need to move one step at a time. People are missing it out looking at the bigger picture. Speaking about the bigger picture, we have another question coming up from Deepak Saxena, who asks, how often should I have prostate screening or checkups after ch- checkups at my age of 48 years?
So, as per the guidelines, routine PSA screening is recommended after 45 years of age. If you are having symptoms of BPH as we discussed, then you should see your urologist. They will get a PSA test as well as a digital rectal examination done. So if you are doing good, then uh, nothing needed as such. But if you are developing symptoms, then better to consult urologist every at least every 5 yearly. Once every 5 year is good enough.
Right. Doctor, the next question is from Jay Jedan. He asks, can you provide information on the long-term outlook for BPH in older individuals?
So in older individuals, BPH symptoms are more compared to the 50 to 60 years of male population. So at around 80 years, they have more BPH symptoms. Most of the patients required to put on medications. The medications are around four types of medications are available. First is a alpha blocker that relaxes the prostate as well as the bladder neck muscles, and it can improve the urine flow. And another is a 5 alpha reductase inhibitor that help in the shrinkage of the size of the prostate gland. Another is a PDE5 inhibitors are also available that can that can increase the vascularity in the pelvic region. That also has been shown some promising result in the treatment of BPH. Certain herbal medicines are also available, but their role in the treatment of BPH is currently doubtful. So we do not recommend those herbal medicines, but those medicines still are available.
Right. Doctor, now coming to the most important question, which would bring a sign of relief to for all the viewers who are watching us right now. Is BPH curable?
BPH is definitely curable. If most of the 50 to 60% of patients get relieved by the medication, so they don't need to go for any kind of invasive treatment. Like surgery is not needed for those patients who are responding with the medications. But those who are not responding with medications, they are developing recurrent urinary tract infection. They are developing bladder stone or diverticula in the bladder of the or the kidneys are getting affected as the urine is not getting emptied properly. Their renal function is deteriorating. They are developing hydronephrosis or hydrouria, that is swelling in the kidney. In those cases, we ask patients to undergo a surgery where we insert a scope in the urethra and we resect out entire prostate gland. So it can be done with electric current also, it can be done with a laser current also. So both sort of treatments are available. So BPH is not a disease where a cure is not available. It is definitely curable. Only thing is you need to visit your urologist and don't hesitate in asking and asking your questions or uh, consulting them.
Right, right. The next question is quite similar. Jayan Deshmukh asks, I'm suffering from BPH. Is this life-threatening? I'm very afraid.
No, no. BPH is not life-threatening condition. There are two types of enlargement in the prostate. First is BPH, like it's a benign prostatic hyperplasia. Another is a cancerous cancer prostate. Prostate cancer is a very slow growing tumor, and treatment for prostate cancer is also available. And there are if it gets diagnosed early in the stage of the disease, like in first or second stage of disease, if it gets diagnosed, then it can also be cured. But once it has been metastatized, then the cure is not possible. But for BPH, cure is 100% possible.
Right. Doctor, now that we know that it's not life-threatening and it can also be cured, well, to all our viewers, the only thing we would want to say is, देखिए बनाते भी हम हैं, बिगाड़ते भी हम हैं. तो जब हम बना सकते हैं तो आप कोशिश कीजिए उसे बनाने का. Don't prolong it. We are repeating it again and again. Do not prolong it. It's all in our hand. Also, I think a regular full body checkup or a routine checkup is very important. We tend to ignore in such things, but try to at least have a checkup, doctor, once in a year. I think that would be fine.
Yes,
What do you
once in a
suggest?
year. Yes, definitely. Once in a year checkup is absolutely recommended, so that at early stage of disease, it can be diagnosed and treated. If patient is having cancer in the prostate, then also it can be treated. What we are seeing in our country is that patients are not coming to the doctors in the early stage of disease, as there is
Exactly.
lack of awareness among patients about the disease, as well as the treatment that is available. So they don't consult their doctors. They consult their doctor when the symptoms have been aggravated. And that point of
Right.
time, if there is a cancer, then complete cure is not possible. All we can do
Right.
is control the disease, but not cure is not possible. So what I would advise is that if you are having any such symptoms, better to consult the doctor, at least get the cancer ruled out.
Right. Doctor, there is another important question coming up from Pratham Singh, who asks, what would be the price of the whole disease to be cured? How much does it cost? Please provide an approximation.
Okay, so lifestyle modification doesn't require any price. Okay, so that is
Right.
absolutely free. Correct. Medications cost around 10 rupees per day therapy, I guess. Okay, but if it's not possible with, the therapy is very cheap, around 10 rupees per day. That is just like a cup of price of the cup of tea. With that uh, uh, price of treatment, your disease can be cured. But if it's still not cured, then surgery is available. So surgery cost around roughly 50 to 60,000.
But,
So treatment
but
is available. It's not
right,
very costly treatment. That's what I
right,
wanted to say.
right. But again, I think that amount of money would also not be required if we
Correct.
focus on ourselves, if we give
Definitely,
ourselves
not
some
all
time.
patients require surgery. Hardly
Right.
5 to 10% of male patients undergo
Mhm.
surgery for their treatment. Only with lifestyle modification and medical management, most of the patients can be managed.
Right. Uh, with time, as we see that we are investing a lot on materialistic thing, but not on real things, not on ourselves. Um, कोशिश कीजिए अपने आप पर इन्वेस्ट करने का, आपको रिजल्ट डेफिनेटली अच्छा मिलेगा. आप ऐसी चीजों पे ना इन्वेस्ट करिए जिससे आपको कोई रिटर्न नहीं मिलेगा. अक्सर हम ऐसे ही करते हैं ना, घर पे इन्वेस्ट कर
Correct.
रहे हैं, जमीन में इन्वेस्ट कर रहे हैं, सोना खरीद रहे हैं, अपने सराउंड हम लग्जरी चीजें खरीद रहे हैं, पर अल्टीमेटली उसका रिटर्न क्या मिल रहा है? स्ट्रेस, बहुत सारा हेडेक, बहुत सारा लोन का हेडेक. अल्टीमेटली आपके बॉडी में वो स्ट्रेस पड़ रहा है, तो शरीर पे थोड़ा सा ध्यान दीजिए. आई थिंक 1 hour, not even 1 hour, I think half an hour to 45 minutes every day can be a solution to everything. तो इतना दूर का ना सोचे. इनिशियल स्टेज प्रिकॉशन इज ऑलवेज बेटर देन क्योर, वी नो दैट. इनिशियल स्टेज में आप अपने एक्सपर्ट के पास जाए, आपको सबसे बेस्ट सोल्यूशन ही मिलेगा. डॉक्टर, वी हैड अ great chat today. Before we leave, any take home note for our viewers?
So take home message is that BPH is a common problem. It's present in all the male above the age of 50 years of age. If you are having any symptoms of BPH like increased frequency, nighttime you have to wake up to pass urine, don't hesitate to visit your urologist for the consultation. And if you follow your urologist advice, then your quality of life as well as your social and mental well-being will improve to a great extent. So that's the take home message for today's conversation.
Well, thank you so much, Dr. Neel Patel, for your valuable time. That was Doctor for us, and it has been quite an informative session for all our viewers. We look forward to many more such sessions in the coming time. And thank you, viewers, for your excellent participation. For more information and updates, stay connected on our FB page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you.